For Val, the diagnosis came as a surprise. It started with pain in her feet.
It's just like um just painful. Like you have pain like from the toes right to the along the top of your feet. That's what I have anyways.
In fact, the pain got so bad, she finally went to see her doctor about it.
Because my feet were really painful.
And what did the doctor tell you?
He sent me for x-rays and ultrasound to find out what the pain was.
She was diagnosed with osteoarthritis, a disease that affects the joints. Val believes years of working in retail on her feet in flat shoes may have contributed. She also lives with plantar fasciitis.
I was really surprised because, like I said, I always have plantar fasciitis, and I thought that's just a flare up of that.
Plantar fasciitis doesn't cause arthritis, but if it affects how someone walks over time, it can put added strain on other joints, which may increase the risk of developing arthritis. A repetitive action can contribute to joint strain, which can also play a role in developing osteoarthritis.
Is repetitive motion where your body is not in a natural state.
There are so many questions about arthritis. The president and CEO of Arthritis Canada Society joined Unison TV to talk about the misunderstandings and the huge impact it has on society. But first, Val tells us how she's not letting arthritis slow her down.
So I just do things like deep water classes, and I do a lot of walking just to keep myself moving. And I find a lot of people now use the walking poles, and they seem to help. I did pick up some walking poles for myself, but I haven't used them yet. But yeah, I think that something like that really helps because then you're more balanced. So, but yeah, that's what I would say. Just keep moving, do things like deep water classes, swimming.
Do you feel any more pain or less pain or
It depends. Like sometimes I don't have any pain at all. And sometimes if I start to get pain, I always walk where I know there's a bench or, a mall or somewhere where I can go in and sit down for a few minutes and then continue on.
My first question is with 6 million people being impacted by arthritis, I guess why isn't it being treated as more of a healthcare crisis?
That's a great question, and I would love your viewers to help me answer it. I think the primary reason we run into so frequently is that people think it is only an older person's disease, that it is wear and tear, and that is inevitable. And none of those things are true. It is a disease that usually starts much, much younger. About a third of the people with osteoarthritis are diagnosed before the age of 45. For all arthritis types, they start, half of them are before 65. For the autoimmune and autoinflammatory types, those are hitting people at all ages, including children, youth, people in the prime of their lives, and primarily affecting women. Autoimmune diseases tend to affect about 80% women. So that one is a real woman's disease. The disease is so complicated. There are over 100 types. Many of those types are very difficult to diagnose. They're quite rare. And so it's almost too overwhelming to try and understand the whole thing. It's almost like too much. And, people will say, well, I have a bad hip, I have a bad knee. They don't. They have a disease. The disease has progressed. It's gotten so bad that you are going to cut out that joint and put an artificial one. It's so serious. But you're right. It's very difficult to help people understand what it is and how it will affect them. I think the missed opportunity in this is really for younger people who have early onset osteoarthritis, where lifestyle choices and diet and exercise and a lot of the things that they have control over could help change the progression of the disease. And it's so hard for that message to get out. I think, primary care, they're swamped. They're like, oh, you have arthritis, off you go. Good luck. And that's it. So it's just difficult. It's really difficult. It's why we wanted to get organized and get the ecosystem together and try and collaborate on writing a plan for Canada and start to tackle this really big problem.
You said a couple of things there that I want to pull apart before we get into the report card. Maybe they're for separate conversations, but just when you said I have the hip ache, so is that are people getting hip surgeries and knee surgeries because they have arthritis?
That's correct. So the vast majority of joint replacements, all joints, are due to arthritis. As an example, 99.9% of knee replacements are due to arthritis. So it is what is causing it. It's the only treatment essentially that we have at the end stage of the progression. But if you're getting a hip or a knee replaced when you're in your early 60s, which is about the average age, that did not start in your early 60s. This disease started in probably your 40s, maybe your 30s, maybe, and then it progressed and it got to the point where you needed a joint replacement. And those replacements are really costly. So one of the things that people don't understand is the heavy economic burden of the disease. It is the leading cause of disability in the country. And it has all of these implications to our healthcare system, joint replacements, meaning hospitalizations, therapy, after care, after surgery care, etc. And when you add that up in Alberta, it's over $5 billion with a B annually. When you add up all of the primary healthcare costs, and this includes for the autoimmune and autoinflammatory types, there are medications that help to modify the disease. Those are very costly, some of the most costly medications that these patients need. And so when you add all this up and the loss of productivity, then you have a huge impact economically.
I I wonder if I'm in the minority majority here, but I didn't know that I thought, well, you get old, you get a bad hip. I didn't connect the two that it was inevitably arthritis that led to that bad hip or those bad knees. Do you find that there's that lack of knowledge out there?
Yes, there is a lack of knowledge. There is a lack of knowledge. And also, I think it's almost stigmatized, right? So people would rather say, I have a bad hip than say, I have arthritis, especially when these are happening in people's 50s. Like people don't feel old. I can speak to that. You don't feel old in your 50s, and yet you have something that is associated and therefore stigmatized. So it is definitely an area where, again, more knowledge is required. But yes, joint replacements are due to arthritis.
Is there any cases where they're not? Because you said something staggering like 99 point what it was.
Yeah.
Like what other cases would there be then? What's the remainder? Is if it's
Trauma.
okay.
So meaning like
Yeah,
you break your hip or you
right.
break your shoulder, you
Mhm.
something like that. But otherwise, for the most part, it is due to arthritis.
But even then, can't the trauma be causing the arthritis too that led to the
Absolutely. So we know a few things. We know that if you have an injury, your risk of osteoarthritis skyrockets. And we know that that can also be true for repetitive motion. So if you think about someone maybe in mining who is doing something that is the same day after day after day, then the joints that are involved they have an increased risk of that leading to arthritis. So those are things that we really want to start to help educate people on. One of the things for us that's really alarming and came out as part of the work that we did around our arthritis plan for the country was that there is an increase in youth sport injuries. And this is leading to an increase in osteoarthritis in these kids at very young ages. And that has a huge impact on their life. They have arthritis more significantly at an earlier, career. They have a career, they have family, they have so many things going on. So we really need to address that, some of those root causes where we know that osteoarthritis. The other one that I can mention is a wonderful project that we're doing in Alberta, which is around hip dysplasia, another cause for osteoarthritis. So if a baby is born, they have hip dysplasia, it is not caught, they will go on to have osteoarthritis, and probably it's the number one cause of early hip replacements. So hip replacements under 40 are primarily caused by untreated hip dysplasia. If that hip dysplasia is treated, they just put a little brace on the baby for about 12 weeks, the hip fixes itself, and like, boom, you're done. You've saved them like a lifetime of pain and costly surgery and all the rest. But we don't have kind of a uniform screening protocol. So we're working with a researcher in Alberta to use a handheld ultrasound. They're checking these babies early and working really well with Indigenous communities. So looking to see how can you really improve the outcomes in rural and remote areas where they may not have access to specialists, or they don't have a follow-up with a pediatrician, or they don't have some of the access that you might have in an urban setting. So that's a fabulous project that is, again, going at the prevention aspect. Like where are there risk factors that where we can intervene?
Is it fair to say that if those people got diagnosed and treated earlier, we could avoid the hip replacements down the road?
Yeah, exactly. We want those joints to be as healthy as possible. There's work going on now with precision medicine, which we're really excited about. So this idea that we could look at your DNA and decide, well, you need this exact medication. It will work with you the best. And we get that to the person as quickly as possible. And especially with children, the possibility of, because you've eliminated a lot of comorbidities, you've eliminated a lot of environmental factors, you've sort of got a pure patient, if I could describe it that way. And to try and get a child on the right drug as quickly as possible and get them into remission, I mean, that's amazing. Otherwise, it's a lifelong disease that they're managing.
And one other thing for you, you had mentioned the advocacy program that you're starting now, or is it starting now? Or can you explain a little bit about that?
Yeah, well, we're real advocates, and that's so important. And we love others to be advocates.
Mhm.
So on our site right now, we are promoting the Arthritis Action Now plan. We want politicians and civil servants to know that this plan exists, and that people support that there is a national plan, and that we're calling on, again, the reduction of wait times and investment in research and all of the things that are in the plan. And people can just very easily put their address in, and it will automatically go to your provincial representative, your federal representative, and the two ministers of health, federal and provincial. And that way, you can write your own story in there. You can add more to it. We have a short paragraph, but people can really share their own personal journey. And it's a great way that citizens, I feel like sometimes as citizens, we feel like we're so powerless, but this is a way to act and to do something positive.
That's wonderful information to let our viewers and listeners know about. And if you could just wrap up by saying, you've said that arthritis robs people of their mobility and independence. We almost take that for granted that, oh, I'm going to be a certain age, I'm going to have arthritis. I can't open this jar, whatever. I'm going for a hip surgery. Can you talk a little bit about that it doesn't have to be this way?
Yeah, well, I would argue it shouldn't be this way. I mean, we are smart enough to figure this out. This disease shouldn't, we need to figure out how to get rid of it. We need to be on a path to cures for these diseases. And that, of course, is going to take time, but it's so prevalent and so costly and has such an impact on productivity and the economy that, as you said, it is a crisis. And we want people to have a better understanding, and we want to improve the quality of people's lives. We want them to stay in the workforce. We want them to be as productive as possible. We want them to, really enjoy their life for as long as possible. And arthritis makes a really huge and negative impact. People are living in pain for long periods of time. That directly impacts their mental health. It has a kind of halo and overarching effect on their whole life. So we want to make a difference.
And I just want to clarify one other question because you had mentioned it's not caused by exercise in itself, but you said caused by repetitive motions. Can you clarify that could that repetitive motion be running, or just to clarify that, just to not scare people away from impact sports like running, um, but you said by repetitive motion. Can you just clarify that, please?
So something is happening. Maybe you're on a manufacturing line, or you're somewhere, like you have a jackhammer in your hand for long periods of time. So these are like not natural motions for the body, and then we put them in these particular positions for long periods of time. That can increase the risk. We need more research on all of this, so I certainly wouldn't, people don't need to be afraid of running. But I think because we don't know why people get arthritis. We don't know why, you have it, I don't, we don't know. And so I think it's like stay active, stay healthy, keep your weight down. All the things that in fact help all chronic diseases, frankly, are equally applicable to arthritis.